Welcome to the Deep Dive, where we cut through the noise and get straight to the essential insights you need. Today we're diving deep into a serious, often hidden threat to our equine friends: Pyrrolizidine alkaloid toxicosis in horses. Okay, let's unpack this because this isn't just about a plant, it's like a silent assailant, a ticking time bomb in the liver.
It really is an incredibly insidious condition. Pyrrolizidine alkaloid toxicosis, PA toxicosis for short. It stems from, well, chronic ingestion of specific plants.
Chronic meaning over time.
Exactly, and its primary target, the liver, leading to damage that is tragically irreversible. So our goal for this deep dive, our mission really, is to arm you with the critical knowledge from our sources. What these toxins are, how they quietly wreak havoc, how to spot the signs, which are often late, and crucially, the proactive steps you can take to prevent this devastating disease. What's fascinating here is how complex it all is.
Right. And that complexity is why this deep dive is so crucial. We've distilled the research, the vet manuals, all the details. So what does this all mean for you, the learner? Well, you can quickly grasp the full scope of this really serious threat. If you own horses or you're just interested in equine health, understanding this is vital. So let's start right at the beginning. What exactly are pyrrolizidine alkaloids, PAs?
Okay, PAs, they're a distinct group of molecules, structurally pretty similar. And what's astonishing is they're found in like 6,000 different plant species around the world.
6,000, wow.
Yeah, it's a huge number. And within that, there are hundreds of different individual alkaloids. And their specific makeup, their concentration, even how toxic they are, it varies tremendously.
Varies how?
Well, between different plant species, sure, but also different parts of the same plant.
Yeah.
And even depending on the plant's stage of growth, it's not straightforward.
Okay, 6,000 species is a lot to keep track of. For horse owners here in the USA, are there particular plants that should be, top of the watch list?
Absolutely. Yeah, while there are many, three main plant families are responsible for most of the problems we see. That's Compositae, Leguminosae, and Boraginaceae.
Okay.
In the U.S., the common culprits, the ones you really need to know, include senecio species. People might know them as tansy ragwort, common groundsel, threadleaf groundsel, Riddell's groundsel, lots of names.
Right.
Also look out for Amsyncia, that's fiddleneck, Sonoglossum, or hound's tongue, and Cordylaria, which is rattlebox.
Rattlebox, okay.
Other important ones are Symphytum, Echium Patterson's curse, and Heliotropium. Though it's worth saying, if we connect this to the bigger picture, economic losses have actually decreased over time.
Oh, really? Why
But
not?
mainly due to better recognition and management, especially with Senecio jacobia, that tansy ragwort. It shows awareness helps.
That is good news. So how does a horse typically get poisoned? Is it like they eat one bad leaf and get sick? Or is it slower?
It's almost always the slower route, chronic ingestion,
Yeah.
meaning horses are grazing pastures that have a lot of these plants mixed in, or maybe more commonly, they're eating contaminated hay.
Contaminated hay, right.
And this happens over weeks, sometimes many months. Acute poisoning, getting sick suddenly, very rare.
Why is that?
Because they'd have to eat a huge amount of the plant all at once, sometimes up to like 50% of their body weight.
Wow.
This doesn't usually happen. This raises an important question. How does that slow buildup actually work?
Yeah, that slow cumulative effect. Here's where it gets really interesting, right? Because it's so deceptive. How does that work?
Precisely. The effects of PAs, they just build up day after day, week after week. Horses might need to eat, say, 1 to 5% of their body weight in this toxic stuff daily for quite a while
1 to 5% daily.
before you even see any clinical signs. And what's really insidious, symptoms might not show up for weeks, months, even years after they first ate the plant.
Years, even after they stopped eating it.
Sometimes, yes, long after they've stopped. The damage is already done, ticking away.
But why would they eat these plants if they taste bad? I thought most toxic plants were unpalatable.
Often they are. But think about hay. Once it's dried and baled, it's much harder for a horse to recognize or pick out the bad stuff.
Ah, okay. Mixed in.
Exactly. Or it gets into silage or commercial feeds, also in really overgrazed pastures or during a drought.
They don't have much choice.
Right. They might eat things they normally wouldn't just to get enough forage. And some plants, like Amsyncia or Cordylaria, the toxin is really concentrated in the seeds. So if grain gets contaminated with those seeds, that's another route.
That really paints a picture of silent, creeping damage. Okay, so when these PAs get inside the horse, what's actually happening? What's the internal process?
Right. So they're ingested, then rapidly absorbed from the gut. Then they head to the liver for metabolism. And what's fascinating here is, this is the critical point, the liver tries to process them. Some get detoxified, made harmless, eliminated, fine. But others are actually activated by the liver's own enzymes through a process called dehydrogenation
Activated into what?
into these highly toxic metabolites called pyrrole derivatives. So the liver, trying to detoxify, actually creates the real poison.
Wow, that's ironic and terrible. So these toxic pyrroles, what do they do to the liver cells?
They're very reactive. They basically bind to the cell's DNA, the double-stranded DNA. And this inhibits cell division, mitosis. The liver cells can't replace themselves properly.
So they can't regenerate.
Exactly. And because division is blocked, the existing cells just expand. They get abnormally large. We call them megalocytes.
The megalocytes, giant dysfunctional cells.
That's a good way to put it. They can't function properly, and eventually they die off. As they die, they're replaced by fibrous connective tissue, scar tissue, essentially.
Leading to.
Progressive liver fibrosis,
And
then
yeah.
cirrhosis, and ultimately liver failure.
And you mentioned lungs and kidneys.
Yeah, the pyrroles can bind there too, though we don't typically see major clinical signs related to kidneys or lungs in horses. It's primarily the liver. Although some experimental studies have shown effects on the heart, like right ventricular hypertrophy and enlarged heart chamber.
So this damage is happening silently, maybe for months or years. How do you eventually spot it? What are the signs?
Well, that's the challenge. The insidious nature means signs often only show up after significant, often irreversible, liver damage has occurred. We call it the chronic delayed form. The liver lesions have been progressing quietly, then suddenly the horse seems sick.
What kind of sick?
Often you see chronic weight loss first. General unthriftiness. The horse just isn't doing well. Poor coat, losing condition. This raises an important question. What specific signs should owners or vets be looking for when that dam finally breaks?
Exactly. What are those classic specific signs?
Okay, the common and classic signs relate to liver failure and something called hepatic encephalopathy.
Hepatic encephalopathy, brain issues.
Yes, that's when toxins the liver can't clear anymore start affecting brain function. So you see that progressive weight loss, the unthriftiness, there's an old term, densite, which captures that wasting away. Horses become dull, depressed, lethargic. They lose their appetite or stop eating altogether. Anorexia.
And the neurological signs.
They can be dramatic. Head pressing, pushing their head against walls or fences, aimless wandering or circling. Ataxia, so incoordination. Frequent yawning is common, sometimes called dummy syndrome because they seem out of it. Apparent blindness, so they might bump into things.
Behavioral changes too.
Definitely. They can become excitable or aggressive or just slip into a stupor, even coma in late stages. Other physical things to look for? Icterus. That's jaundice.
Yellowing.
Yes, yellowing of the gums, the whites of the eyes, sometimes the skin. Photosensitization is another one.
Skin problems in sunlight.
Right. Especially on white areas, the skin gets damaged by the sun because the liver can't process certain plant pigments properly. You might also see GI signs, diarrhea, sometimes with straining or constipation. Swelling under the chest or belly, or down the legs, it's subcutaneous edema. And sometimes ascites, fluid buildup in the abdomen.
Any others? Even less common ones.
Less commonly, maybe difficulty breathing, like inspiratory dyspnea, gastric impaction. And very rarely, with some Crotalaria species, you might see acute signs like sudden death from liver hemorrhage or respiratory problems.
That's a huge range of signs. It sounds incredibly difficult to diagnose definitively. How do vets approach it?
It absolutely is a diagnostic challenge because of the delay, because the signs can be non-specific early on. So a really thorough history is critical. Asking about potential exposure, what plants are in the pasture, where did the hay come from, and understanding how the horse's condition has changed over the long term.
Okay, history first. Then I assume blood tests are important. What do those show?
Yes, blood work is key. You'll often see elevated liver enzymes, things like AST, SDH, GLDH. These indicate liver cell damage or death.
Leakage and enzymes.
Exactly. And others like GGT and ALP might be up too, especially GGT, which often points towards more chronic, ongoing issues like bile duct changes. And this raises an important question. It's a real curveball in severe chronic cases, end-stage liver failure.
Let me guess, the enzymes might...
They might be normal or even low. Because there's so little functional liver tissue left, it's just not producing or leaking those enzymes anymore.
Wow, so normal could actually be really bad news in this context.
It can be, yes. That's why you need the whole picture. You also look at liver function tests.
Like what?
Serum bile acids. These are usually elevated, often the most sensitive indicator that the liver isn't doing its job clearing good aim. Bilirubin, total and direct, will be up That's what causes the icterus, the yellowing.
Huh.
Albumin levels might be low hypoalbuminemia because the damaged liver can't make enough protein. That contributes to the edema, the swelling.
Okay.
And blood ammonia levels can be high. Ammonia is normally detoxified by the liver, so high levels correlate with the severity of the brain signs, the hepatic encephalopathy.
Anything else in the blood?
Sometimes low blood sugar, hypoglycemia, and really severe liver failure.
So blood tests give clues, but might be tricky. What other diagnostics are used? Ultrasound? Biopsy?
Yep. Abdominal ultrasound can help. You look at the liver size, it might be small and shrunken in chronic cases, or sometimes enlarged early on. Look at the texture, signs of fibrosis, but the real gold standard for a definitive diagnosis and to see how bad the damage is a liver biopsy.
Taking a small sample of the liver.
Exactly. Under the microscope, you see characteristic changes.
Yeah.
Those megalocytes we talked about, biliary hyperplasia, which is proliferation of bile ducts, and fibrosis, the scarring. Now, these changes are classic, but maybe not 100% unique to PA, so you interpret it with everything else.
So the biopsy is key, but ideally confirmed by?
Ideally confirmed by actually identifying the PA-containing plants on the property, or finding them in the horse's hay or feed. That links the characteristic liver damage directly to the cause.
Okay, this sounds like an incredibly grim diagnosis once you have it confirmed. Is there an antidote? Can it be treated?
Yeah, this is the tough part. There is no specific antidote for PA toxicosis. The damage done is done. So treatment is really supportive care. It's aimed at stopping any more toxin coming in and managing the signs of liver failure. This raises an important question. What's the absolute first, most vital thing to do?
Right. What is that most critical initial step if you even suspect this?
Immediately remove the horse from the source, get them off that pasture, stop feeding that hay, no more PAs going in. That is paramount.
Okay, stop the poison. Then what? Diet.
Yes, dietary modification is crucial. You want a diet that's easy on the liver, so high in easily digestible carbohydrates, low in protein.
Like what kinds of feed?
Think corn, oats, beet pulp, maybe some molasses for energy. Feed small meals frequently. This reduces the metabolic load on the liver. And absolutely avoid high-protein feeds, like alfalfa hay or soybean meal. Too much protein breakdown creates ammonia, which the failing liver can't handle.
Makes sense. Any supplements that might help?
Potentially. Supplementing with branched-chain amino acids, BCAAs, might help manage the neurological signs. B vitamins are important, especially thiamine, and maybe antioxidants like vitamin E or vitamin K1 if there are clotting issues. Other supportive care can include IV fluids if they're dehydrated. Lactulose is often given.
What does lactulose do?
It helps trap ammonia in the gut so less gets absorbed into the bloodstream, reducing the hepatic encephalopathy signs. Sometimes antibiotics are used, too, to reduce gut bacteria that produce ammonia. Gastric protectants like omeprazole might be needed. If there's edema or ascites, diuretics can be used, but very carefully. And managing photosensitization means keeping them out of the sun, treating skin lesions.
So a lot of supportive care. But if we look at the big picture, what does this all mean for the prognosis? Is there real hope for recovery?
Honestly, the prognosis is generally poor to grave, especially once you see those clinical signs of liver failure or the neurological problem. Yeah, because the damage is cumulative. It's irreversible. By the time you diagnose it, often there's just not enough functional liver tissue left for adequate regeneration. Many horses, unfortunately, continue to deteriorate despite treatment. They're often humanely euthanized because of the severe debilitation or uncontrollable neurological signs.
Are there any that recover?
Some might survive, especially if it's caught incredibly early, maybe with just mild enzyme elevations and no major clinical signs yet. But even then, it requires intensive long-term management, and they generally don't return to their previous level of fitness or activity. And here's where it gets really interesting, or rather, really sobering. There are clear, poor prognostic indicators.
Like what?
Severe neurological signs are a very bad sign. Significant icterus, really profound changes in the liver function tests, very high bile acids, very low albumin, low glucose. And if the biopsy shows widespread severe fibrosis, the chances are extremely slim.
That is incredibly sobering. It really drives home the point about prevention.
I'm-
So, given that grim prognosis, prevention isn't just important, it's everything. What concrete steps can our listeners take right now to protect their horses?
Prevention is paramount.
Mhm.
It starts with recognizing these plants, knowing what they look like in your fields, in your pastures, and crucially, remembering they are still toxic when dried in hay. Their toxicity doesn't just go away.
So vigilance in pastures and feeds.
Yes, if we connect this to the bigger picture, It comes down to good management practices. That means managing pastures well to prevent these weeds from taking over, using appropriate herbicide control when necessary, avoiding overgrazing, which forces horses to eat things they shouldn't. There's even an interesting biological control method,
Oh, what's that?
using sheep or goats. They're much more resistant to PAs than horses are.
So they can graze it down first.
Yeah, exactly. You can use them to graze heavily contaminated areas to reduce the plant load before horses go on there.
That's clever. But it also raises an important question. For someone with, say, a busy pasture or buying hay from different sources, this vigilance sounds tough. What are common mistakes people make?
Good point.
Hmm.
A common mistake is just not knowing what the plants look like, or assuming that because the horse seems fine now, the pasture must be safe. Remember that delay.
Right, the ticking time bomb idea.
Exactly. Another mistake is relying only on herbicides, but not removing the dead plants. They're still toxic when dead and dry.
Ah, okay.
And with hay, people might assume good quality means PA-free, but weeds can be hidden inside bales.
So what's one practical, maybe non-obvious tip?
Don't just glance at your pasture. Walk it thoroughly, especially after rain or if the ground's been disturbed or if you've reseeded. Get down and look closely. And when buying hay, ask questions. Where did it come from? Can you get a forage analysis? And visually inspect every single bale if you can, especially if it's from a new supplier or area. Look for any suspicious weeds mixed in. A small amount can cause big problems over time.
That's incredibly practical advice. Walk the pasture, inspect the hay. Okay, let's unpack this one last time. As we wrap up, what's the single most important takeaway from this deep dive?
I think the core challenge, the thing to really internalize, is how a seemingly harmless plant out in the field can act like a ticking time bomb inside the horse. It causes this slow, cumulative, irreversible damage that often only reveals itself when it's essentially too late for effective treatment. So this raises an important question for everyone listening. Given that grim prognosis once symptoms appear, how might understanding this slow, cumulative nature of the damage fundamentally change your approach to managing pastures and sourcing feed for your own animals?
That's a powerful thought to end on. A critical shift in perspective needed. So what does this all mean for you, the vigilant horse owner or curious learner? It means this deep dive makes it crystal clear. Vigilance, knowledge, and proactive prevention are truly your most powerful defenses against this silent, insidious threat. Keep observing, keep learning, and stay informed.